Good evening, everyone. Welcome back for another interesting session on Doctor Speak. Hope all of you are doing well and are safe with your families. Before we start today's session, I would like you to click on the like button and let me know if I'm audible. Also, would appreciate if you would let me know which city you're from in the comments box. It's very good if you would let people around you know about this initiative. Spread the word in your network. Let many people take advantage of this initiative that we have launched because it's extremely useful for people to gain a lot of knowledge and maximize the advantage they get with this. I guess we have some responses coming in. Thank you, everyone. Thank you, audience, for sending your responses. And I guess we are good to go. Let me tell you a little bit about Dr. Speak very quickly before we start the session. Dr. Speak is an initiative launched by us at Future Generali India Life Insurance in the month of July. Through a 12-episode series of live sessions, we invite renowned doctors from various fields who share relevant information in the field of their specialization. The sessions conducted so far have been around mental health, they've been around vaccination, skin and healthcare at home, and the last recent one we had done was on cancer. Now, let's quickly come back to today's topic. It's a very relevant one, which is ENT, its problems and care. ENT, as we all know, ear, nose, and throat are the fundamental functions of life that make living so rich and wonderful. Yet, when one of them would not work, they will really cause problems to us. It can become very inconvenient, and it can also be, our life can also be at risk because of the same. Since these sensory organs are constantly exposed to the impurities and germs in the air, it becomes essential to learn about taking care of these vital organs. The session today is with Dr. Amol Patil. Let me introduce Dr. Amol Patil to you. Amol Patil has more than 12 years of experience and is a senior ENT consultant with Nanavati Max Super Speciality Hospital. He is a gold medalist and a postgraduate in the field of ENT from BJ Medical College and has completed his MBBS from the Rural Medical College in Ahmednagar. He is a new age ENT surgeon who has expertise in modern day surgical procedures and also has a vast experience in routine as well as advanced techniques. He has undergone specialized training in the field of endoscopic anterior skull base and lateral skull base surgery. He regularly attends various national as well as international conferences and workshops and also takes active participation in live surgical as well as cadaveric demonstration workshops for the benefit of young budding ENT surgeons. Good evening, Dr. Patil, and a very warm welcome to you for a live session on Doctor Speak.
Good evening. Myself, Dr. Amol Patil. I'll be talking to you about common ENT problem and its solution. So, as all of you know, ENT is ear, nose, and throat. So, these are very important structure, very vital organs as far as the sensory sensations are concerned. So, ear deals with the hearing, nose with a sense of smell, and throat with a taste sensation. So all these are extremely important in our day-to-day life. So I'll just be taking you through next 40-45 minutes talking about what are the common problems or regular problems or complaints which patients have regarding the ear, nose, and throat. And I'll tell you about what are the solutions or what are the care you can do for maintaining the health and hygiene of ear, nose, and throat. So first, we'll be concentrating on the ear. Ear is an organ for hearing. So what are the routine complaints which we come across in the general population? So hearing loss is one of the major complaint. Apart from that, there's a blockage in the ear pain, ear discharge, vertigo. These are the routine problems in day-to-day life. So I'll be taking each complaint separately and discuss in brief about what are the reasons for this and what can you do when you suffer from one of these problems. So hearing loss. So once when we are talking about the hearing loss, you should understand the structure of an ear. So as you can see, that's your ear. So this is the external part of the ear. That's your eardrum. That's the middle ear, and that's the inner ear part. So hearing loss most commonly affect the people after 50, 55 or 60 years of age. So when it is an age related hearing loss, we call it as presbycusis or senile hearing loss. It usually affects the inner part of the ear. So when inner part of the ear and the nerves are affected, most probably this hearing loss is because of the weakening and aging of this part of the body. As there's a weakening and aging of this part of the body, most of these patients will require some form of amplification of the sound. Most of the medications as well as surgical procedures don't tackle with this part of the hearing loss. So what is the solution for it? So best possible solution for this is a hearing aid. Most of the people do really wear a spectacles. So spectacles is nothing but an aid which is used for improving the vision. Similarly, the hearing aid is a form of solution where a aid is used to amplify the sound and correct the hearing loss. But due to a social stigma, the hearing aid has not got a popularity that spectacle has got. But if you ask, function of the both is similar, is to aid a particular function. So hearing aid improves the hearing. 10 to 15 years back, there are many patients who complain that these hearing aids gives rise to the echo, or there's a abnormal amplification of the sound, or they used to call it as a noise in the ear. But nowadays, with a technological advancement, we have come up with a hearing aid. These are basically a digital hearing aid. Why they are called as digital hearing aid? Because they are programmable hearing aids. So they can be connected with a computer, and fine tuning of the instrument can be performed according to the need of the patient. So these are tailor made for a patient. So echo, noise, these are cancelled in this hearing aid, and a word is presented to the ear in an amplified manner as a word only and not the noise. So the social stigma related to the hearing aid should go down, and it should be acceptable to a general population. So this is the solution for the age related hearing loss. But when it comes to the young children, there are few children who are born with a hearing loss, and there are few who develop early in their life. In those patients, surgical treatment of that is possible. With the advancement in the surgical procedures, there's a surgery called as cochlear implantation surgery, where implant is inserted in the inner ear, and this implant can give patient absolutely normal hearing, and he can have a perfectly normal life and normal hearing for rest of his life. So that is a surgery for young patients. But in case of the adult, most commonly it is an hearing aid which should help them with a hearing loss. So coming to the next complaint. Next complaint is a blockage. This is a very common phenomena, and as you can see in this picture, this brownish bit which is blocking your ear canal, it's nothing but a wax. So there are many patients who come to me and ask, is a wax any disease? So formation of wax is not a disease, it's a normal human phenomenon. But there's a subjective variation. Few people get a wax which is kind of thick in consistency. It gets accumulated in the ear canal and forms the big chunk. And when it blocks the ear canal completely, it needs to be removed. I have a patients who come to me every 6 months as well for cleaning. So Does everyone require cleaning of the ear or cleaning of the wax? The answer is no. Why answer is no? Because there are few people who gets this kind of thick wax and it's getting accumulated and giving rise to the blockage. Those patients only require frequent cleaning. But majority of the population has a wax which is watery or liquidy in consistency. Whenever they take shower or head bath, it gets washed away with the water. So that is the most important thing. Other important problem giving rise to the blockage is the fungus and the foreign bodies. So there are many patients who ask me whether we should be using earbuds or not. So earbuds use is not recommended in by any of the specialists. Why? Because this is a diagram which will show you why it is not recommended. So that's your external ear, that's your ear canal, that's your eardrum, and this is a wax. So whenever you use an earbud, you'll be pushing this wax more inside, and it can go inside and touch the eardrum, and the partial blockage can be converted into the permanent blockage. And when you try to force it more inside, it can give rise to the trauma to the ear. So I have many patients who had come with a damage to the eardrum because of the use of the earbud. So cotton bud earbud use is not recommended by the specialist. Next thing. So this is a picture showing the similar thing. There was one of the patient who tried to clean his ear, has left a small cotton inside the ear next to the eardrum. If he has gone little bit more deep, he could have damaged the eardrum. So foreign bodies. So many a times you can have a live insects as well going in the ear, causing the blockage of the ear. There are many times the small children who has a habit of putting small objects in the ear. That is also a fairly common thing. So next complaint we are coming to is ear pain. So there are variety of reasons for the ear pain, but most common reason for ear pain is infection. So this is a rainy season, and in a rainy season, the most common thing which we come across is a fungal infection of the external ear and the eardrum. As you see in this picture, that's your eardrum, and there's this whitish and blackish spots over it. We call it as wet tissue paper appearance, which is caused by the fungus. Fungus is usually two types in the ear. One is whitish fungus, which is usually due to the Candida species, or a black fungus, which is due to a Aspergillus species. So these patients have itching inside the ear. Sometimes it can be an intense pain as well as blockage of the ear. So this requires cleaning of the ear and use of the ear drops for 8 to 10 days time. This is also aggravated by cleaning of the ear by a person. So whenever you clean your ear either with a cotton or you clean your ear with any of the object, it can lead to small micro abrasions or ulcer in the skin of the canal, and from where fungus can grow in. As the fungus grows, it gives rise to the pain and blockage. Other important reason for the ear pain is cold, wax, and trauma. Trauma can also give rise to the pain. Coming to the trauma. So ear pain caused by the trauma, usual history for these patients is blood stain discharge after any sort of the trauma. So any patient who has blood stain discharge, heaviness in the ear pain, and a blockage sensation or the hearing loss should get it checked. As you can see in this picture, that's your whole of the eardrum. And in the center of it, you can see this small hole in the eardrum surrounded by a minimal amount of the blood. So there's a perforation caused by the trauma. So as there's a perforation, majority of these patients, if they don't get infection, This eardrum heals up in 4 to 6 weeks time. It is similar to what we get a small abrasions over our skin or scratches over the skin when we fall, and it heals up in few days. Similarly, the eardrum also has a tendency of normal healing, but you have to prevent infection and water going inside the ear. So, coming to the next complaint, which is ear discharge. Ear discharge in a patient in whom there's a recurrence of this ear discharge, usually aggravated by the cold and the pain, getting better with the medications and coming back again. So these patients might be having permanent perforation in the eardrum. So as you can see in this picture, that's your whole of the eardrum, and almost 50% of the eardrum is damaged and there's a perforation. So any patient who has recurrent discharge from the ear, pain in the ear, requiring medication for it, should get it checked. And if they have this bigger perforation usually doesn't heal with a medication, and these require a surgical procedure where correction or repair of this eardrum needs to be performed. It is a daycare procedure, very simple one, and can be performed with a relative expertise. As well as there's a chance of ear discharge with the infection of the ear canal as well. So these infection might be bacterial or fungal, which can be treated with antibiotics as well as ear drops. Next, very important symptoms, especially in the elder patients, is vertigo. Vertigo is different from dizziness. So vertigo is feeling of everything around you going for a spin. So it's a round feeling. Dizziness is usually imbalance. When you walk, you feel imbalance. So vertigo can be because of the inner ear problem. Why does vertigo occur? Because your inner ear, in association with your brain and your eye, act in synchronization to maintain the balance of the body. So any part of this cycle is affected, either your ear, brain, or inner ear is or eye is affected, it can give rise to the imbalance. But classical rotatory feeling is due to the inner ear problem. I would like to specify about one thing where a particular position triggers the vertigo. We call it as a positional vertigo, where when you change your position of the head, it gives rise to the intense vertigo staying for few minutes and getting better. This can be treated with a simple maneuver where you perform a simple repositioning maneuver, and it can help majority of the patients of vertigo. Coming to the next set, that is nose. So nose is an organ, sensory organ for your smell sensation. So one of the most common complaints associated with the nose is congestion, headache, obstruction, loss of smell sensation, rhinorrhea. Rhinorrhea is nothing but watering from the nose, sinusitis, and bleeding from the nose that we call as an epistaxis. First and foremost is a congestion and headache. So one of the most common entity which involves majority of the population, especially in the metro cities, is an allergy. So these patients have a typical history of frequent sneezing episodes. So when they start sneezing, they sneeze for at least 10, 15, 20 times at one go, followed by watery nose, followed by watery eyes. Your nose becomes red and there's a congestion of the nose. So, what exactly is an allergy? Allergy is nothing but the body's response to the particular substance. It can be anything, it can be simple dust at the home, dust mite, it can be pollens in the air, it can be pollution, it can be food material as well. So, as it is a body's response to the particular thing, allergy can be controlled. if you ask me a question, if allergy can be treated permanently, as it's the body's response, it cannot be completely cured, but with a simple medications, it can be controlled to a manageable level. And there's another thing majority of the population which suffer from is a sinusitis giving rise to the intense headache. So whenever your sinuses gets blocked, you get an headache. So what is a simple solution for allergy or sinusitis? So most commonly these can be treated with what is called as saline irrigation of the nose. So how does saline irrigation of the nose help? Saline irrigation is nothing but a simple water along with a sodium chloride in it. So how does it help? It helps in washing away the allergens from the nose. As the allergens from the nose are washed out, it doesn't give rise to the symptoms of allergy to a significant degree. So that's a simple remedy at home. Other things are exercises and healthy diet. So next complaint is loss of smell sensation. So these loss of smell sensation has affected many people. That was due to COVID-19 infection. Why there's a loss of smell sensation? As the virus affects your nose at the top of the nose, roof of the nose, there's an olfactory nerves. These are the nerves of the smell sensation. So affection of these nerve by COVID infection, majority of the population with a COVID-19 infection has suffered from loss of smell sensation. But it is a temporary loss and majority recovers in 5 to 10 days time. There are few patients this recovery is delayed. So recovery of the nerve from infection is delayed even for 6 to 9 months time after infection as well. So tumors and the polyps are the other reasons for loss of smell sensation. Coming to the next set of complaint is an obstruction. So breathing difficulty. There are many patients who suffer breathing difficulty from nose. It might be one nostril, both nostrils. Majority of the patients have it at the night and it affects the sleep. So as the sleep is affected, majority of the patient doesn't have a quality of life or active day next day when your sleep is affected. So what are the reasons for obstruction? There's a DNS. DNS is nothing but the deviated nasal septum. Other things are polyps, tumor, and an allergy. So I'll take you one by one. So DNS is deviated nasal septum. It's nothing but the bone of the nose which is deviated and increased in the size. So as you can see, that's a CT scan picture of a nose. That's your eyes on both the sides, your nose bone. Usually it is straight like this, but as you can see, this yellow arrow is pointing that on the left hand side your bone is overgrown and it's blocking the left side of the nostril. So does this deviated nasal septum requires treatment? Almost 20 to 30% of the population suffer from this deviated nasal septum, but majority of these patients are asymptomatic, where they have this structural abnormality but they don't get any obstruction. So if there's no obstruction, we call it as an asymptomatic deviated nasal septum. It doesn't require any treatment. But once it starts giving rise to the breathing difficulty, nasal flow of an air is affected, you will require it to be treated. So it's basically treated with an endoscopic surgery, which is a day care. It is a scarless surgery. So there's no cut, no sutures on the face. Next important subset is a polyps. Polyps is nothing but the overgrown mucosal structures in the nose. So as in this picture, you can see this is a nostril of the patient and you can see a big polyp in the nasal cavity, right nasal cavity. It's completely blocking. So what are the complaints of these patients and what gives rise to the polyp formation? So complaint of these patients first and foremost is breathing difficulty, nasal blockage. Second thing, as it blocks the breathing, it also gives rise to the loss of the smell sensation. As your sinuses are blocked, you will get an headache, frequent headaches, and you'll have a recurrent runny nose and sneezing episodes as well. So most common reason for this is either repeated infection of the nose or an allergy. So these two things. So these can be treated when they are in the early stages, when they are relatively small, can be easily treated with a nasal saline irrigation as well as nasal sprays, which can reduce the size of the polyps and you can have a normal breathing. But when it becomes significantly large in size, they will give rise to the blockage and they requires a surgical removal. Next is a tumor. So tumor is nothing but a growth inside the nose. So this tumor can be a simple tumor, which we call it as benign, or it can be a cancerous. I'm just showing you an example of a young child around 18, 19 who came to us. That's his CT scan of the nose. You can see whole of the CT scan is blocked with a big tumor. So this patient came to us with a nasal blockage and bleeding from the nose. So any person who's suffering from nose blockage and occasional bleeding from the nose should get himself checked by the specialist to rule out any growth happening inside the nose. So this patient came to us with a big tumor. We perform an endoscopic surgery on him, and that's his post-operative CT scan, and you can see whole of the tumor removed. So this is a patient on the next after 2 days of the surgery. So that's the interview of the case. I'll stop this video. Other thing, this is a patient came after 7 days after the surgery. The why I want to show you this is because there's no scar on the face of the patient. There's no stitches. It was an endoscopic surgery. Patient has a normal life after the surgery. There's no associated comorbidities or complication associated with this surgery. Okay. So next set of complaint is epistaxis. Epistaxis is nothing but the bleeding from the nose. Fairly common phenomena in elderly population. Why so? Because most common reason for this bleeding is hypertension. So blood pressure on the higher side can give rise to one of the vessel which gets damaged. When it happens inside the nose, it gives rise to the bleeding from the nose. Other important factor in the elderly population is those patients who are taking medications for their heart related problem. So these are the blood thinner medication. When they are taken in prophylaxis or prevention of the heart related elements. So these patients are more vulnerable for developing epistaxis or bleeding from the nose. There are simple home remedies for epistaxis which can be done at home. First and foremost is an ice application. So ice application usually shrinks the vessel. When the vessel shrinks, the bleeding stops. Other simple maneuver which can be performed at home is a pinching of the nose. So pinch the nose for 2 to 3 minutes time. So why 2 to 3 minutes? Because that is the time required for clot formation. So if you pinch your nose for 2 3 minutes, most of the bleeding will subside. So these are the small remedies which you can perform at home. But if the bleeding persists or it recurs, then you need to see an specialist. Coming to the throat, throat is an important organ, and there are almost everyone who must have suffered from a throat pain or pharyngitis once in their lifetime. So what are the complaint associated with the throat is pain. Hoarseness is nothing but the change in the voice. Stridor is a breathing difficulty. Then there's a neck masses, and last, nothing but very important thing is, especially in today's scenario, is a snoring, where you have a noisy breathing during the sleep. Coming to the most common complaint, that is a throat pain. So majority of the population do really suffer from tonsillitis and pharyngitis, which is a very common phenomenon, and it especially affects after you eat something cold or spicy or oily stuff. So why you get a throat infection after eating cold things or in a cold environment? Because this cold give rise to the local reduced blood supply of the throat. As the blood supply goes less, the immunity of the throat is temporarily reduced. As it is reduced, the bacteria and the viruses grow inside the throat and give rise to the infection. So that is a very common thing. So how you can prevent this is avoid repeated cold foods and cold ingestion. Avoid oily and spicy stuff. So these are the regular home remedies where you can control your throat infection from happening. Another important thing in day-to-day life now is a reflux. Reflux is nothing but getting a burning sensation inside the throat or heartburn. So it's basically an acid from the stomach which regurgitates back in the throat, giving rise to the burning sensation in the throat and foreign body sensation in the throat. This can be prevented by avoid long-term fasting, avoid oily spicy stuff, regular exercise, and small frequent meals. So these are the remedies for that. Coming to the hoarseness of voice. Hoarseness is nothing but the change in the voice. Change in the voice can happen. The most common reason for change in the voice is an infection of a voice box or the larynx or even the throat. So majority of these infection gets better, swelling of the vocal cord go down in 7 to 10 days time. But any patient whom having a change in the voice for 8 to 10 days time and not getting better with a regular medication should seek an expert opinion, especially after 50 to 60 years of age group, because it can be a growth inside the voice box. So this is a small video where I'm showing you this is a right vocal cord, that's a left vocal cord, and there's a big polyp. So polyp is nothing but the overgrowth of the mucosa. So this is a benign thing, but many patients can have a cancerous growth in the vocal cord as well, giving rise to the hoarseness of voice. So how to prevent it? Prevention is avoid a repetitive use or abuse of the voice. So shouting should be avoided. These usually affects the people who use their voice regularly, like singers as well as teachers. So voice rest is one of the important thing in the treatment of this, as well as speech therapy. But when you have big polyps like these, they needs to be removed. So coming to the next set of complaints is a neck masses. So any mass in the neck. So there are different important structures which are present in the neck. The common being a thyroid, parotid gland, the submandibular salivary glands, and there are lymph nodes. So any mass in the neck requires evaluation either by a sonography or a needle testing which is called as fine needle aspiration cytology. So any patients in whom there's a mass in the neck should get it checked by a specialist followed by a sonography. Coming to the snoring. Snoring is a noisy breathing during the sleep. I divide this in the two parts. One is a cosmetic snoring and one is a pathological snoring. Cosmetic snoring, we call it cosmetic because it just produces a nuisance value of noisy sleep and disturbance to the partner. But there's I'm more concerned as far as pathological snoring is concerned. So pathological snoring, not only there's a noisy breathing, but it also reduces the oxygen supply going to the body during the sleep, and it has a long term implication in the form of increased risk of heart attack, increased risk of stroke, and many metabolic effects. So, how you'll come to know whether there's a pathological snoring or not? One of the most common complaint in this patient is a daytime somnolence, which means you feel excessive sleepy during the daytime. When you sleep in the night, you have to get up in between the night gasping for air. Other important sign is when you wake up in the morning, you are not fresh. You feel lethargic or dull whole day. So any patient having snoring and all of these complaints should get it evaluated. But what is a treatment? The most important treatment for this is reduction of the weight. So weight reduction and lifestyle changes in the form of healthy diet and exercises can cure almost 70 to 80% of the patient with a snore. So, coming to whatever we have experienced in last 2 years, COVID-19 and its ENT effects or ENT related thing. So many patients have got a hearing loss because affection of the hearing nerve. Bell's palsy. Bell's palsy is nothing but a nerve of face getting affected by the virus, and it can give rise to the deviation of the face. So that's there. Vertigo due to affection of the inner ear. Loss of smell and taste, which is usually temporary. But out of these, the most important thing which we have experienced over the last 3 or 4 months is a mucormycosis infection. So this is an opportunistic infection which has affected many patients who has got a COVID-19 infection and treated for the same, giving rise to the affection of not only the sinuses but eye, and it can also spreads to the brain as well. So why it is called as black fungus? Basically, it's a misnomer, but it's called black fungus because it affects the structures in the and eye and makes it look like black because of blood supply getting reduced and that tissue becoming dead. So early diagnosis in a mucormycosis is extremely important, and early diagnosis can treat these patients. So any patients who is a high risk patient who has a complaint of nasal blockage, COVID-19 infection treated with the steroids, diabetes mellitus, having bleeding, black color discharge, headache, orbital swelling, pain in the eye, watering from the eye, should get an expert opinion done, get a nasal endoscopy done in an OPD, and a MRI also help in early diagnosis. Early diagnosis in these patients not only reduce the mortality but reduces the long-term morbidity as well. So take home message from me to you is that for as far as hearing is concerned, avoid loud noise exposure. Repeated exposure to the loud noise in the long term give rise to the damage to the hair cells, and these damage to the hair cell can lead to hearing loss in the future. Regular exercise, as it helps the whole body, it helps your nose, it helps your ear, and it helps your throat as well. So it makes your breathing better, it helps you in reducing the allergy related complaints, It helps you from sinusitis as well as repeated infection of the nose and the throat. Weight reduction also goes a long way. Healthy diet forms a very important part as far as nose and ears concerned. For the hearing, the magnesium and the potassium are the two very important nutrients which are there for a healthy hearing. So, any fruit or any diet which is good in magnesium and potassium should be regularly taken in your diet. Other thing is for any of the complaint which persists for little longer than the routine should be checked by an expert. So I would say thank you to you, and I'll end my presentation here. I can take any questions if you want to ask. Thank you. Stop sharing.
Hey Shiraz, you're mute. Shiraz, you're on mute.
Yeah, Shiraz, I can hear you. Yeah.
Yes, sorry, I wasn't audible. I'm saying thank you, doctor. It was really very wonderful, very simply, very nicely explained on all the three major vital organs of our body, starting from the ear, that you shouldn't be using a earbud, and that how injurious it could be to your ear. And I really like what you covered on the loss of smell thing. Like, we are not aware that anyone can, come in today's time, lose their sense of smell due to COVID or not due to COVID. They may have some tumors, polyps within their noses. So, very nicely explained. Thank you very much. I would also like to tell you that, because of there are so many diseases pertaining to ENT. There's tonsillitis, there is sinusitis, nose bleeding, vertigo. They're all due to ENT problems. So I would like to know, which are the recent cases you've had currently. What are the kind of cases and patients who come to you with similar problems these days?
See, in the last 2 3 months, as I explained in my last 2 3 slides, a majority of the patients who had COVID infection came to us with a sinusitis related complaint, and they had a mucormycosis infection, and we treated them well. So there's a multidisciplinary approach involved in the treating of these mucormycosis. And majority of the ENT problems which we routinely face is a ear infection. Usually, in case of a rainy season, we are getting a lot of fungal infection of the ear. So, fungal infection of the ear usually needs a one-time cleaning by a doctor, followed by a simple antifungal drops. These antifungal drops can be used for 7 to 10 days time, and we get a lot of relief from these problems. And now the rainy season with the fluctuation in the weather and all those things, we are getting a lot of cases of upper respiratory tract infection and allergies as well. So those are the routine cases we are seeing nowadays.
Okay, so I have a few questions coming in from the audience. We have Abhinav who wants to know, that if you have earwax in your ears, does it cause deafness?
Earwax can give rise to the temporary deafness because it's blocking the air going to the eardrum. As the air going to the eardrum is blocked because of these wax, what you need to do is put the ear drops, get it little soft in 3 4 days time, and it can be removed by an ENT specialist by just pushing little water inside the ear. So it's a very simple thing, and it is a very common problem in many people who is having a thick wax formation, giving rise to the blockage and the temporary hearing loss. It doesn't give rise to any permanent hearing loss.
Okay, that's nice, Doctor. Hope, Abhinav, that addresses your question. We have another question from Sushant. He's saying he's not like very old, he's pretty young, and he wants to know, like, how does he know that he's having a hearing loss problem? How do you identify that there is an issue with your hearing?
Early hearing loss, usually your family members are the best people to tell you whether you have early hearing loss or no. So that can be explained by two, three things. If a person tells you that I have to repeat two, three times any questions or any statement before you understand that, or other thing is family member telling that you're putting your TV volume or a music volume at a very high level. So that is small things at home care you can understand if you have a hearing loss or not.
A couple of questions more. I'll be clubbing two questions. There is a question from Gitika. She's asking a question that, frequent usage of earphones these days, does that cause your hearing loss or can it cause any ear infection? Also, we are so busy on our mobiles full time, most of the times we are on our mobiles. Does that add to any hearing problems?
See, use of the earphone definitely gives rise to the two problems. There's a short-term problem. If it's too tight and you're frequently putting in and out, it can give rise to the small trauma to the skin of the ear, and that can give rise to the repeated infection of the ear. Other important thing or the long-term effect of use of the earphones. Earphones gives you a concentrated sound to your eardrum, and that is a source of the trauma, noise trauma, what we call as to the ear. In a long term, over the period of 10, 15, 20 years down the line, it will definitely give rise to the hearing loss. Usually hearing loss in an age related scenario starts at 60 or 70 years of age, but if you have a constant noise induced trauma, it can even start at the 45 or 50 years of the age as well. So, headphone or earphone use should be restricted, and a sound level should be mild to moderate.
Okay, that was really good to know because in times like these, when everybody is working from home, you have your earphones on half the time and you're always on your Teams call or virtual call. So I guess everybody should be careful when it
Other
comes to
simple
that.
thing, other simple thing I like to add is that you can use alternatively. So don't put both the things together. Say right ear and left ear. You can use right ear for say 2 hours time. Give a rest to the right ear. Put it on the left side, use it for 2 hours, then again switch it back to the other ear. So in that way you can give little bit of rest to the one ear, so that helps in a long term.
That's a good idea. I guess all of us should start implementing it. It's good. Next question we have is from Toshali. Her question is whenever she goes, at higher altitudes, it causes her nose bleeding. Is that normal or is there a way in which she could prevent that?
See, high altitude, it's usually high altitude, we call it as a barotrauma. So barotrauma usually can affect your nose, it can affect ear as well. It's the similar thing when you experience during the flight as well. So and when you go at the high altitude, if you have little dry air there, so it can give rise to the drying of the nose. So simple thing is keeping your nose moist, and it can be done with a normal saline irrigation regularly in the nose, or using a moisturizer or a gel which is available for keeping your nose moist. So that can help you in reducing the bleeding from the nose at the high altitude level.
Next, we have Rati, and she wants to know about do you see regular infections with swimmers? And what can someone who regularly swims do to keep their ears clean and reduce the chances of infection?
Swimming does really give rise to the repeated ear infection, and these are most commonly a fungal infection in the ear. So, most important thing if you have a infection happening in your ear due to swimming is use of the earplugs, and not allow any water to go in the ear when you are swimming. So, use of the earplugs is recommended for those who are getting a repeated infection in the ear.
Next interesting question we have is from Rajesh Singh. He is asking us, these days you have these virtual calls, trainings through the day, and continuous talking these days. How do you take care of your throat because of that?
Too much of a talking on the phone as well as normal talk as well can give rise to the strain on your vocal cords. So the most important thing, any part of the body which is under sprain or strain, is to give rest to that part. So once you finish off your work, uh, try limit your talks. Okay, avoid lengthy talks with anyone. And other important thing is you can just give a hot fomentation to your neck twice a day. That will soothe your throat and avoid too much of cold and oily stuff.
I guess you had covered this question in your presentation, but I will ask it again for the convenience of all. Amol, he needs to know, are earbuds or swabs okay to clean the child's ears or even the nose?
Uh, Cleaning of the ears and nose is not required because both of these structures are self-cleansing ones. I'll give an example. I almost have 4 to 5 patients in last 2 years where the mother has tried to clean the ear and cause damage to the ear. So use of earbud in a children's is absolutely not recommended.
Okay, doctor. So then we have questions pouring in that if you don't use earbuds, what's the best next step? Because definitely you feel a little bit of irritation in your ear if you're not cleaning your ear with earbuds. So what do you do? Do you go to a ENT to get your ears cleaned up, or how do you deal with that?
A simple thing you can do at home is one thing is you can put a torch inside the ear and see whether there's a brownish material or not. Majority of the patient won't have that. Itching is just a sensation where you feel like intense urge to clean your ear, and putting the earbud just satisfies that urge. It doesn't satisfy any purpose. So at the most what you can do is you can use simple eardrops, or you can use a moisturizer when you have a dry skin giving rise to the itching in the ear.
So when you say you use a moisturizer, how are you supposed to use the moisturizer
You can
in your
just put
ear?
a moisturizer in the ear and lie down for a minute or so. That's it.
Okay, similar to what you would do like a ear drop.
Yes, exactly.
Okay. Next question we have is from Tarun. He is asking a question whenever he cleans his nose, and he presses his nose to clean his nose, and it starts sneezing continuously, and he gets around close to 15 to 25 sneezes, and even his eyes start watering. So, what is this problem called? Is it sinus, or is there another name to this?
This is a classical thing of an allergic rhinitis. Okay, so he is basically suffering from the allergy or irritative kind of rhinitis. So the most important thing what he can do is do the regular saline nasal irrigation that will wash away his allergens. Do some sort of the physical activity or exercises that will improve the blood supply to the nose and reduce the symptoms of an allergy.
Okay, next question we have is from Kevin Thomas. He has a sinus problem and he wants to know, is surgery a good option for that? And if the surgery is going to be risky, and what would be the success rate if he goes in for the surgery?
See, it's if you ask me, the sinus related pain or the headaches are extremely common thing in today's scenario, but it needs to be evaluated properly first. So first and foremost, there's an expert opinion you need to take. You need to have a nasal endoscopy performed, and the most important thing is get a CT scan done of a nose and sinuses, but that is only after an expert opinion. If the CT scan shows a significant abnormality, then he will definitely be benefited with a surgery. And surgery is a daycare endoscopic surgery which has a very minimal of a side effects, and patient can go back to the normal life in 2 to 3 days time.
Okay, doctor, I had a question. These days, because of the rains and all, people are prone to sicknesses. They're getting regular cough and cold. But due to the COVID scare, they're scared to like go to a doctor and get a checkup done. So, what is an ideal time? What is the ideal scenario for somebody to wait and check on his cold and cough before visiting a doctor?
Most of the cold and cough which starts, especially in the Indian scenario, is due to a viral infection, and most of the viral infections are self-limiting. So these viral infection usually gets better in 3 to 4 days time. If a patient who's having a complaints which persist after the 4 days of starting the symptoms, he should seek an opinion from a doctor and get it treated.
Okay, we have one question from Umi, and she's talking about a neck pain that she has, a shooting neck pain on her left side up to her shoulder. And she's been doing hot water fermentation, she's been taking medicines and putting some ointment. It's not helping. Is there any advice you could give her?
Any shooting pain which is happening on the one side of the neck and it's going to the shoulder, it's usually most probably due to a nerve related problem or neurologic problem. So she needs to get herself checked by a next or a spine specialist, because it can be a early signs and symptoms of cervical spondylosis as well. So get it tested and evaluated by a spine specialist.
Thank you, Doctor. Hope, Umi, this answers your question. Doctor, next question we have is from Tejal. She has a question as to how parents can protect their children from a ear infection.
Ear infection in case of the kids most commonly arise due to a common cold or the nose related problem. So your nose and your ear is connected by the tube which is called as the Eustachian tube, and this tube is fairly at a straight line. In case of the kids, as you grow it becomes more of an oblique one. So in kids the chances of the nose related infection going to the ear is fairly common, and this can be prevented by a simple cold medications. Once the patient starts the cold, give him the cold medicines. When the cold is under control, it will prevent the infection going inside the ear.
Next question I had was, there are different causes of vertigo. Vertigo is a serious disease, and many people are really inconvenienced with that. So, what are the different causes of a vertigo, and does one just get treated by himself at home, or just wait for it to go off, or do you really need treatment for that?
See, as I explained you in my presentation, there's something called as vertigo. Vertigo is everything going for a spin around you, or you feel you are a moving object going round, round, round. So that's the vertigo. This kind of complaints most commonly are due to the ear related problems. Many of the people who get dizziness is basically an imbalance. So when you walk, when you stand, you feel like you are going to fall off. So these are the imbalance, or these are majority due to either systemic, eye related or a brain related complaints. So any patient who is suffering from vertigo or the round feeling should get it evaluated, because it can be treated. And there are variety of the reasons for vertigo. There are variety of reasons for dizziness and imbalance, right from diabetes, blood pressure, your high sugar levels, then brain related, reduced blood supply to the inner ear, reduced blood supply to the brain. So these all things are related, and there are a variety of the reasons for vertigo and dizziness.
Thanks, doctor. I'll not take too much time. I'll ask you the last question. It's basically for loss of smell. Many people have loss of smell, and it's just not because of COVID. Maybe they've had a nerve injury earlier, head injury, or any kind of thing. But can they get the smell sense back after a few years? Are there some advancements in technology and science wherein a surgery would help somebody get his loss of smell back? smell sense back.
So any smell sensation loss, which is there for a quite some time, say year or two, should be evaluated first with a nasal endoscopy to rule out whether there are any polyps, any tumor, or get an MRI done to rule out the similar thing, the polyp or the tumor. But majority of the patients who have these kind of complaint at some point of time had a viral infection which has involved the nerves and given rise to the neuritis. When you have neuritis which has not responded for 2 to 3 years time, can give rise to the loss of smell sensation for a longer duration of the time. And when you have these nerve related loss in the smell sensation, it's relatively difficult that it will come back after 3 to 4 years time. If you ask me, is there any surgery? As of now, there's no surgery which can get this thing back, but there are definitely a treatment methods which are available which can improve your sense of smell over the period of time.
Thank you, doctor. That was very, very informative. Thank you for taking up the time, spending time with us, and educating us on all the important vital organs which we wanted to know about. Any last piece of advice you would like to give us to the audience?
See, the most important thing, there are three very important factors which not going to help your ear, nose, throat. It's going to help your whole body. One thing is exercise, keeping your weight under control, and the healthy diet. So all these 3 points are extremely important. You follow these and you'll have an extremely good ENT health.
Thank you, doctor. That was indeed a very insightful session. Thank you very much. Hope to see you again. I would like to thank the audience as well for joining in, and we'll be back with more informative sessions next week on Doctor Speak. Until then, due to the season change, everything and other things, take good care of yourself, stay home, stay safe, stay healthy, and do get yourselves vaccinated if you haven't done as yet. Thank you, everyone. Thank you, Dr. Amol Patil, for joining us. Thank you.
Thank you. It was a pleasure.